Medical costs keep going up, but what can you do about it? Many people are enrolling in high deductible health plans, or HDHPs, with health savings accounts, or HSAs. Many people never meet their deductible. Are you paying for premiums on a plan that you never use? When the end of the plan year comes, you don't get that money back. A high deductible health plan allows you to put some of that money back into an account to save for your future. Your medical insurance covers services for a doctor, hospital, or facility. When you pair your HSA account held by a bank, the money you put into this account will help you cover the cost of these services with tax-free advantage and interest earnings. Here's how a high deductible health plan works. Costs are lower because deductibles are higher, and everything applies to deductible except for preventive care. Any illness or injury that you see a doctor for, get testing, or prescriptions would all apply to deductible. Everything except for preventive care, such as well child visits, immunizations, cancer screenings, and your annual preventive care exam. In fact, preventive care is covered at 100%. Now there are even some medications that would be covered before deductible. Medications for asthma, cardiovascular, cholesterol, and many more. When you're enrolled in a HDHP, you can put money into an HSA. Take a portion of what you would have paid for full premiums and put it into an HSA. Save and invest the money for medical use into retirement. It goes in tax-free, it grows tax-free, and it comes out tax-free if it's used for an eligible medical expense. There is no use it or lose it rule, and you can take it with you when you leave employment. So what do you do when you need services? Let's say you need to go to the doctor because you have an ear infection. First of all, visit an in-network provider and present your medical insurance card for your HDHP plan. You will receive an explanation of benefits from your medical insurance showing how much you will owe your provider with an in-network discount. Then, you will use the funds from your HSA to pay your provider. Let's say you must have a procedure at a hospital. When you visit your in-network provider, ask them if they have a cash upfront discount. Use the funds from your HSA to pay upfront. When the EOB arrives, make sure it doesn't show a lower amount than you paid upfront. You will want to shop around when you need services. Check with your carrier to compare costs of different doctors and facilities. They don't all charge the same amount. Seek out pharmacy programs with free apps like OneRx and GoodRx. Before you have services, negotiate with your provider. Sometimes they'll give you a cash upfront discount. The IRS changes the maximum benefit annually. For 2020, it is $3,550 for a single person and $7,100 for a family. If you're over the age of 55, you can add an additional $1,000 per year. Keep in mind, if you're enrolled in another non-HDHP plan through a spouse, Medicare, or military, you cannot contribute to an HSA. You cannot have money in an FSA account. Spend down your FSA money before you can open and start contributing to an HSA. Thanks for listening today. I hope you start building your health savings account soon.